today's episode, I will be discussing about Tocilizumab. But before that, let me introduce myself. I'm Nurse Jane, based in the Philippines, and welcome to my YouTube channel. Tocilizumab is an immunosuppressive drug, and it belongs to the class of drugs that is interleukin-6 blocking antibody, or it is a humanized monoclonal antibody against interleukin-6 receptor. If you watch my previous videos about the cytokine storm, I have discussed there about the cytokines, that these are small glycoproteins which includes the interferons, the interleukins, the chemokines, the CSF, and the TNF. But now we will focus on the interleukins, especially the interleukin-6. So these interleukins regulate the immune cells differentiation and activation. The interleukin-6 is part of the interleukin, which can be pro-inflammatory cytokines or anti-inflammatory myokines. This is released by the monocytes and macrophages in response to the inflammatory cytokines. It produces inflammatory effects in inducing the transcription of factors in multiple pathways of inflammation. Part of the analysis and diagnosis inside the ICU for the severe and critical patients of COVID-19, they will get a blood sample and they will check it, and the result is how it will enter into the large pulmonary circulation. So these pathogenic T cells and inflammatory monocytes with high levels of interleukin-6 secretions may enter into the pulmonary secretions in large amounts. So these large amounts of IL-6 incite the inflammatory storm. It will result to cytokine storm, as I've said before, and lead to immune disorder that will lead to severe to critical COVID-19 patients. The immunotherapy strategy about the Tocilizumab has been formally included in the diagnosis and treatment or protocol program of COVID-19. And as I have said, it has given EUA by the FDA last June 24, 2021. This Tocilizumab can be used for patients with extensive bilateral lung lesion opacity, or in severe or critical patients who have elevated laboratory detected interleukin-6 levels. So according to the BMC, if the patients with poor initial efficacy of Tocilizumab, it can be given again after 12 hours.
This is the effect of Tocilizumab in the body.
Tocilizumab is the second drug ever recommended by WHO, or the World Health Organization, after recommending dexamethasone in September 2020. This drug belongs to the class of monoclonal antibodies, or humanized monoclonal antibodies, or simply MABs. These monoclonal antibodies, or MABs, is also used in treatment of other diseases, including cancer. However, the Tocilizumab, or the MABs, have been priced extremely high, that low-income or middle-income countries has difficulty in acquiring this medication. But there is another solution to prevent from hospitalization or even to severe or critical case of COVID-19 patient. It is given free by the government. It's the COVID-19 vaccine. And if you have the chance to get vaccinated, get vaccinated. That's all for today. Thank you for watching. And don't forget to like, share, and subscribe.